So as we assess the neck for problems or misalignment, we do this in several different ways. The first way we're going to talk about today is checking out range of motion. So typically in the neck there are a few different types of range of motion. And what we do is have a patient go through each type, and we're going to look for the degree by which they can move. And it tells us possibly which side has restrictions, where they're feeling tension, where they're feeling pain, and that gives us some indication as to where the problem might be in the neck. Okay? So typically, again, starting with range of motion, we'd ask the patient to tuck their chin to the chest, and we're looking to see if they can how far they can get that chin on down. Then we'll have them look up towards the ceiling as far as they can look. We're going to see how far they can go up that way. Then we're going to have them get back into the neutral position. We're going to have them rotate their head, looking over their shoulder to the right as far as they can, and then to the left as far as they can. And we're looking to see if there's an equal symmetry to that, or if one side is tight and doesn't go as far as the other. And then next, we're going to have you actually square yourself away a little bit here. And we're going to check lateral flexion, so bringing ear to shoulder here, and then bringing ear to shoulder there. And again, as we did with rotation, we're just checking to see if there's symmetry within the motion. Okay, maybe twist again a little bit. After that, after we assess the range of motion and talked about those situations there, then it's easy enough to go ahead and palpate the spine. Using my hands, we're just going to go on each level, and we can start at the top. So if the base of the skull is here, we've got C1, 2, 3, 4, 5, 6, and 7 is right down here at the base of the neck. And basically what we're going to do is we're going to kind of rock back into extension, and we're just trying to feel how that joint play is from segment to segment, seeing if there's a good flexibility there. Then we're going to do a little bit of rotation and seeing if we're feeling that spine move from side to side nicely, seeing if there's points of fixation where that joint just doesn't want to move, where it's locked up. And these are real clear indicators as to how that spine is doing. We're also then going to palpate the paraspinal muscles, or the muscles along each side, to see if one side is tighter than the other, because that indicates areas where the spine is rotated or out of alignment, and putting stress on how the muscles are responding. We can also then palpate the base of the skull to see if there's any trigger points or knots, because those are indications as well, typically of how this upper cervical spine is situated and if it's putting pressure there as well. Okay. From there, we then can also view the neck on an X-ray to see if there's other changes to talk about as well as that indicate misalignment.